Hello, today we'll deal with COPD. This is a chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. And we will make a diagram here showing what this disease means. As you hear from the name, it's chronic. It means that this disease will take many years and it can take forever. So the patient will never be treated totally. So he will always have problems during his whole life. And these are usually people who are smoking. So unfortunately, the people who are smoking have the highest risk of getting COPD. And chronic means the time, then obstructive means that the lung is obstructed, the airways of the lung. So pulmonary is the lung, so it's an obstruction of the pulmonary system. Disease, this is just says that it's a disease. So actually it's a chronic disease, meaning it takes very long time for the treatment to take an effect also, and the treatment will be lifelong. It's an obstructive disease of the pulmonary system, so the lung system. So just for you to remember, when you see COPD, please think of a lung and then think of the tube here, that is the airway in the lung, that is then blocked. And why is it blocked? It's blocked because you get a lot of production of mucin, for example, mucus, and this will plug the airway system here. And especially the bronchioles, bronchiolitis it's called. So we have a lot of tubes in the lung, and the main tubes are coming here from your trachea. As you see here, the main trachea, and then it divides into two bronchi. These are still very big airways. COPD is not affecting these big airway tubes, it's affecting the smaller ones. And the terminology, the definition of where it is affected is distal to the terminal bronchiole. So these are trachea, then bronchi, and then this divides into smaller bronchioles. And the terminal bronchiole is even smaller, that I cannot really draw here. So if I would zoom in, if you take a zoom in picture here of this one, then you would see that the bronchioles comes here, and then it's called terminal, which means that, for example, from this level, it starts to make tubes like this, and then it makes some sacs like this. And then in these sacs we have a small alveoli, and please check that in Google image. Write these things, terminal bronchioli, and write, for example, the word acinus. I'll write it like this, acinus. This is composed of three things. We have ducts, then we have sacs, and then we have alveoli. So three things. This is acinus, this whole part here, and this is terminal bronchiole. Terminal means the end of the bronchiole. So this is the bronchiole, and it's the end part. So this is the whole. This whole part will be acinus, and please check the Google image and you will understand it better. The most important thing is for you to understand that this is a chronic inflammation. As you see here from the name also, you can remember it's from COPD, chronic obstructive pulmonary disease. It's also chronic inflammation. So it's an inflammation reaction from your body, which will then block this terminal part of your lungs, not the proximal part, which is trachea and bronchi, and therefore we are dealing with acinus. Okay, this is the terminal part. The definition of terminal, everything distal means, how should I explain this? So if you have something here, and here you have two arms, this is the body, and then you have two arms, you have two legs. This is the distal part of your arm, and this is the proximal part of your arm. Proximal means here, the beginning. Distal is the end. So it's the end part of the bronchiole, so terminal bronchiole. Distal to that. So here's the terminal bronchiole, and distal to that you have this acinus. and you will have something called respiratory bronchiole. This will be this small part here. This is still a bronchiole, but it's in the respiratory part, because these airways, the big airways, are not involved in the respiration. What does respiration mean? Respiration means the conversion from, for example, oxygen to carbon dioxide in your lungs. So when you exhale carbon dioxide. When you inhale oxygen. And this happens not in the big airways, it happens in the small airways. So COPD is a small airway disease, not a big airway disease. It's a small airway disease, which is, as we said, distal to the terminal bronchiole. So we have the terminal bronchiole here, and from this part we call it respiratory bronchiole, because this part is involved in the respiration, and therefore it's called respiratory bronchiole. And then it becomes the acinus, which is acinus alveolar duct, alveolar sacs, and alveoli. And this alveoli part, this is where you have the real conversion between oxygen and carbon dioxide, and this will happen because you have a lot of arteries coming here and a lot of veins. And for example, the arteries then bring some carbon dioxide to this acinus part, and then it exchanges. So here, if you have oxygen here, carbon dioxide here, and then you have oxygen here coming from. So this is the artery, and if this is the acinus, so this is the airway, then this will just change place. Okay, carbon dioxide will go into the airways, and then you will breathe out carbon dioxide, and from the artery you will and from the airways you will get the oxygen, which will move into the artery, and therefore your blood supply is always getting fresh oxygen from the airways. And this happens, as we said, in the acinus part, not in the big airways. Enough of that. So what happens is that we will have a blockage here in this part, and this will now cause a mucus plug, and we will have something called a hyperplasia of goblet cells, and all this will lead to a reaction called inflammation, and all this will plug, so it will make a big obstruction, and then you cannot breathe anymore. You will not get so much oxygen in your blood, and therefore you will have difficulty breathing. This is COPD. This is what happens. And what I want to tell now is that in the acinus, the thing that happened also is that the wall of this sac, of this alveoli, will be destroyed, and this is now called then emphysema. The emphysema. What is the definition of emphysema? Before we do that, I need to mention a diagram and to show you that we have COPD related to emphysema. So we'll draw a Venn diagram. We will make a ring here, and then another ring here. Then we will make a rectangle like that, and then we will mark this part, this inner part here. Okay, this means we have 1, 2, 3 rings. This is asthma. This part is chronic. I will write chronic bronchitis. And this is emphysema. Emphysema. So we have chronic bronchitis, emphysema, and asthma. What do we have in the middle? In the middle we have COPD. That is marked here in between. And what is this rectangle? This rectangle will stand for all the diseases causing airflow obstruction. Airflow obstruction. So it means, if you look at this chart now, it means that COPD patients can have a component of emphysema. So if we take These are different types of patients. If we take this part, this is a COPD patient with emphysema. If we take this part, this is a patient we have COPD with emphysema and bronchitis, because you see the two rings collided. This is emphysema and bronchitis plus COPD. This is a patient with COPD and chronic bronchitis. This here is a patient with emphysema and no COPD. This is a patient with chronic bronchitis and no COPD. This patient is a patient with airflow obstruction, but no COPD, no asthma, no emphysema, no bronchitis. It's outside of this, but he has airflow obstruction. Name an example. Airflow obstruction except for these diseases. You swallow something, you eat something, and you block your big trachea, your big airways, and then you have an airflow obstruction. You don't need to have a disease to block the airflow obstruction. So you don't need one of these. That means that we have many types of patients. Here, for example, here we have an asthma patient without airflow obstruction because it's outside of this rectangle. Everything within this rectangle has an airflow obstruction. This means that we have an emphysema patient here that has no airflow obstruction because he's outside of the rectangle. He has no COPD because he is not within this part. So as you see here, all emphysema patients that have airflow obstruction have COPD. That would be a definition. All chronic bronchitis patients that have COPD will have airflow obstruction. So if you remember only this Venn diagram, you can come up with all type of cases here. For example, what is this type of patient here? This patient has an airflow obstruction because it's within the rectangle. He has COPD because he's in this marked area. He has chronic bronchitis because he's within the chronic bronchitis ring, but he's also within the emphysema ring, and he's also within the asthma ring. So this patient has everything. Asthma, chronic bronchitis, emphysema, COPD. There exist people with these types of things, that we will have 4 diseases at the same time. This is not rare, okay? So it means that when you have a patient with COPD, please don't exclude emphysema or asthma or chronic bronchitis. You need to think of all this because this will be important for the treatment. You cannot only treat one of these and exclude the other ones. You need to find out if he has components of all these. And what we call then is something called overlap syndrome. So we can have, for example, an asthma COPD overlap syndrome. Asthma COPD overlap syndrome. This means that we have a patient with asthma. He's not here because we need to be in the COPD part, so we would put him here. Why here? Because we didn't say that he has chronic bronchitis, so he cannot be in this ring. He cannot be here because he don't have chronic bronchitis. He can only be here because he has asthma and he has COPD. And therefore he has airflow obstruction, because the definition of COPD will be airflow obstruction. That's the definition of COPD. You have a persistent airflow obstruction, because asthma, the definition of asthma is that we have a reversible obstruction. This means that an asthma patient that is here at the moment can get here into this part, which means he can get worse, and then he gets an airflow obstruction, but only reversible. Reversible means that he can, after some treatment, come back to the normal state without any obstruction, and that is typical for asthma. So asthma patients are defined as having a reversible obstruction due to chronic inflammation. All these diseases are due to chronic inflammation. So the key word in COPD, emphysema, asthma is some type of inflammation. The definition of chronic bronchitis is that you have productive cough. You're coughing for more than 3 months every year for more than 2 years. Once again, chronic bronchitis is more than 3 months for more than 2 years. So more than 3 months every year for more than 2 years. Then you have chronic bronchitis. And you need to have what? Productive cough. Productive cough does not mean that you only cough very dry cough, which means nothing comes up. Productive cough means that you get a lot of, not just sputum, you get a lot of mucus stuff, okay? Purulent stuff. That is chronic bronchitis. More than 3 months every year for more than 2 years. Emphysema definition is that you have an enlargement of these airway sacs that we said we had this acinus, and we have a permanent enlargement of this. So instead of, for example, it was this small and now you have this big, that is emphysema when this becomes that, and that is due to that the wall gets destroyed. This wall gets destroyed in the airspace wall, and therefore you get a permanent enlargement, and then you cannot really breathe anymore because the structures were destroyed. And not only does the wall get destroyed, also the small capillaries, the arteries surrounding this will all be destroyed, and they will get the hyperplasia, it's called. The artery wall will get thicker, they will collapse, they will obstruct, and so on. That is emphysema. Okay, so one can say that COPD, the 3 main things that happens in COPD is that we get emphysema, that the wall gets destroyed, and we get a permanent enlargement of this airspace. And at which region? This is important. At emphysema, we talked about the terminal bronchiole, distal to that. It's not the big airways, the smaller ones. So emphysema is distal to terminal bronchioles, destruction of the walls, and that is a component of COPD. So when you think of COPD, you think of emphysema, then you think of chronic bronchitis, and the third thing is that we have a pulmonary vasculature destruction, because we said the small arteries and capillaries here will be destroyed. So these 3 things is something that you have to remember, plus that you have a mucus plug, increased amount of mucin production, usually by smokers. When you smoke, you get an increased amount of mucin production. Also, people with symptoms of chronic bronchitis, we said, which is more than 3 months every year for more than 2 years, symptoms of this will also cause a lot of mucin production. And all these three things are components of COPD. As we can see here, what I highlighted chronic bronchitis and emphysema. And with emphysema comes the vascular system. And that's the 3 things that you need to remember. Good. What about some definitions? Because this video will talk about some pathology. This was some pathology. And it will talk about some definitions. When you hear me talking about something called GOLD, this will stand for Global Initiative for Chronic Obstructive Lung Disease. So Global Initiative for Chronic Obstructive Lung Disease. When I talk about GINA, that will be Global Initiative, and that actually Global Initiative, you see here, that is this part. Global Initiative for Chronic Obstructive Lung Disease. Here is Global Initiative of Asthma. These 2 things are something that the WHO and these 2 organizations have come up with, and these are good for classifying patients with COPD and classifying patients with asthma. And based on these classifications, which we will deal with other videos, based on that you can get a very good picture of which patients will get which type of treatment. But later on we will discuss this. But I wanted you to know these 2 phrases. Other definitions is important, that when I say emphysema, then I want you to remember that we have 3 types. You have something called proximal. Then you have something called distal emphysema. So distal, proximal, distal, and pan-acinar. So pan, and we'll write it like this: acinar, acinar. We have proximal acinar, distal acinar, and pan-acinar. We said that emphysema is damaging the distal to the terminal bronchioles, and we said that this is called the acinus, and the acinus contains of ducts, sacs, and alveoli. The acinus, the acinar part, we can affect the proximal one, the distal one, or pan, which means the whole part. So if we have here, I will just write I will draw a tube here. Here is the beginning. Here's the beginning, which means proximal means that it affects this part, distal affects this part, and pan affects everything. That's the only definition. What more to remember is that the proximal will affect the respiratory bronchioles also. So if this is the acinar part, it will also affect the beginning here, which was the respiratory bronchioles. Distal will of course affect the distal, and pan everything. Why is this important? The associations of these two different diseases can be following. The proximal part will be usually caused by smokers. So when you have a proximal acinar emphysema, then you have usually smoking patients or patients who are working in coal workers. Then we call it coal workers pneumoconiosis. This is a very, very strange name. You can look it up in the internet. So these are coal workers or smoking patients. This is the proximal one. The pan one, this is something related to alpha-1 antitrypsin. Alpha-1 antitrypsin. You draw it like this, alpha, and then 1 antitrypsin. Antitrypsin deficiency. Alpha-1 antitrypsin deficiency. That is pan. And distal one, this part, will usually be causing spontaneous pneumothorax. Spontaneous pneumothorax means that you have a lung. For example, you have two lungs here, and one of them will collapse. So instead of being so large, you will have a lung that is collapsing totally. So it's getting collapsed like this. So it will be maybe like this, small one. And this means that this lung cannot move anymore. It is totally destroyed. This cannot function anymore, and the patient will have severe breathing problems. This lung is good. Everything is fine with that, but this collapsed due to spontaneous pneumothorax. And that is usually when we have COPD with emphysema of the distal type, distal acinar emphysema, which is this part. Then you have spontaneous pneumothorax. When you have in the proximal acinar part, then this is related to smoking patients. When you have in the pan region, so all the region, then you have usually a deficiency of alpha-1 antitrypsin. And this is a disease that you inherit. So you inherit it as a child. And therefore it's very important that you check this type of enzymes in the laboratory, and then you can find out if this is the case, that you inherited it. So you didn't smoke, you didn't do any coal working things, and you got this pan-acinar. Then think of a deficiency of alpha-1 antitrypsin. Good. So to summarize now, I want you to remember some definitions. We said that GOLD stands for Global Initiative for Chronic Obstructive Lung Disease. GINA stands for Global Initiative for Asthma. Then we said that we had a Venn diagram. We drew 4 types of diseases. We had chronic bronchitis, emphysema, asthma. Then we had COPD in the middle. These 4 types of diseases are all somehow related to airflow obstruction. That was the rectangle. And then you can do the combinations how you want. Okay? That means we have 4 diseases that you need to remember. That means that chronic bronchitis, you need to know the definition, which was more than 3 months of productive cough every year for more than 2 years. That is chronic bronchitis. Emphysema definition was that we had some permanent enlargement of the air spaces because the air wall, the airway wall was destroyed due to this chronic inflammation. The other thing that we had was asthma. Asthma was a reversible airflow obstruction compared to COPD, which is always a permanent one. So it's not reversible. And this will be important when we check the diagnostics, because you can do some spirometry or lung function test, and then you will see if it's reversible, then it's asthma. If it's not, then it's usually COPD. Okay, and then we had the definition of emphysema. Which regions of it is affected? Is it the proximal part, the distal part, or the pan-acinar part? We have proximal acinar, distal acinar, or pan. And depending on these, we have, for example, distal part usually causing pneumothorax, spontaneous pneumothorax, proximal one usually due to smoking, and then the pan usually due to this alpha-1 antitrypsin deficiency. So these are the 3 types of those. And then we will discuss all the symptoms and treatment in other videos. I wanted you to remember that COPD is a very serious disease due to smoking usually, and I want you to remember that we have here a disease that have many combinations with other diseases, chronic bronchitis, emphysema, asthma, and all these cause airflow obstruction. And as we said, always remember, it's not the big airways, it's the small airways. So it's everything distal to the terminal bronchioles, which is the acinus part. Acinus, we said, contain of ducts, sacs, and alveoli. And all these 3 things can be affected, plus the arteries around it, capillaries around this. And when we talk about acinus plus capillaries, then we actually talk about lung tissue. So in COPD, we have an obstruction of the airways plus a destruction of the parenchyma, we call it, the lung tissue, which is composed of acinus, capillaries, and the interstitial tissue around it. That's it. I thank you very much for listening, and I hope you enjoyed this video. And please look for the next chapter, which will be symptoms, treatment, and so on. Thank you very much.